Okay, here are two helpful frameworks for new medical learners to figure out how we interact with patients. Both of these frameworks are nice because they tend to be really patient-centric. They cause you to not cause harm to the patient when you're doing a physical exam. And the second part is they give you a really systematic way of examining a patient so that you don't forget to check for certain things. First, that you should look, feel, move, special tests. And that's an order in which you should work with the patient. You know that you do this, followed by this, followed by this in all of the regions so that you can gather information like a detective as you go. It's going from least invasive to most invasive. For example, let's say Timothy here has a rash right here on his arm. You want to look at that first before you go and maybe touch that, and maybe that hurts him or something like that. That's framework number one. So the two are, can't really do two fingers. Do three and one. And number two is that when we're examining a patient, typically we go from the zoomed out, the peripheral to the central. We work our way in. It has two general purposes. One is that the periphery is generally least invasive. So, touching Timothy's hand, typically pretty appropriate. But if I go and just immediately touch his abdomen, that can seem a little bit intrusive and invasive for patients. The second part is a framework that you try and take a big view at the patient first, which is why they always tell you to look at the patient from the end of the bed, and then you gather information as you work your way kind of towards the core organs that keep a person alive. Those are two helpful frameworks for medical students as they start learning to do interactions. And our score system will eventually start to reflect that students use that type of organization as they interact with these virtual patients. So, best of wishes in your learning.